decades, right? But what if I told you the entire foundation of that fight was flawed? Seriously, right from the very beginning. Today, we're going to unravel a story about a huge mistake made half a century ago, a clue that was hiding in plain sight this whole time, and a discovery that might just change everything. And really, it all boils down to this one question. In our mad dash to find new drugs, new weapons to kill cancer, did we completely overlook our greatest ally, the most powerful weapon we already have, our own immune system? Okay, so to really get a grip on where we are today, we've got to rewind the clock. We're going way back to the start of modern cancer drug development. Because for over 50 years, the entire field has been built on this one single standard way of doing things, how we find and test new drugs.
So think about it. If you're a scientist and you think you found a drug that can kill a human tumor, how do you test it? You need to grow that tumor somewhere, right? The solution they came up with was to stick human cancer cells into a lab animal, usually a mouse. But, and this is a huge but, there was a big problem. Any normal animal with a working immune system would see that human tumor and immediately go, nope, you don't belong here, and just wipe it out.
So the scientists, they got clever. They came up with a workaround. They started breeding this special kind of mouse. They called it the nude mouse. And it was born without a real immune system. It was, from their perspective, the perfect solution. Because this little mouse couldn't fight back, it wouldn't reject the human tumors. And that meant researchers could test thousands and thousands of potential drugs on them. And right there, that is the original sin of cancer research. You see it? For more than half a century, the entire system for finding new cancer drugs was built on a model that completely, totally ignored the patient's immune system. It's like we were testing a poison against a tumor in a complete vacuum. Okay, so what did this actually mean in the real world? What was the impact of this fundamental flaw? Well, it created this massive blind spot. And the crazy part is, the consequences were right there, hiding in plain sight in medical journals for decades. And listen, this isn't some brand new revelation. I mean, look at this timeline. Way back in 1983, studies were already showing that radiation therapy messes up our immune cells. Then in 94, another big paper comes out showing chemotherapy does the exact same thing. Fast forward to 2015, and the evidence is it's overwhelming. This immune damage from treatment was directly linked to patients not surviving as long. The clue was there this whole time. Now, there's a medical name for this condition. It's called lymphopenia. And all that means is you have a really low level of lymphocytes in your blood. And you got to understand, lymphocytes are like the Navy SEALs of your immune system. We're talking about your T cells and your natural killer cells, the NK cells. These are the guys whose whole job is to hunt down and destroy threats. And just to give you some perspective here, if you could look at all the components of your blood, you'd see that these lymphocytes make up a huge portion of your white blood cells, your body's defense army. So when chemo and radiation come in and just wipe them out, well, we're left completely vulnerable. And this is where that blind spot becomes crystal clear. Look at this. When chemo causes other blood cell counts to drop, we've got FDA-approved drugs for that. Your neutrophils get low, boom, here's some Neupogen. Your red blood cells get low, no problem, here's Epogen. But for low lymphocytes, for lymphopenia, nothing. A big question mark. It was the missing piece of the puzzle in cancer care. And this slide, man, this shows the real human cost of that missing link. There was a big study in 2015 that followed patients after they got chemo and radiation. And what they found was chilling. The patients whose immune systems didn't bounce back, the ones who stayed in that state of lymphopenia, they had a more than 2 times higher risk of dying. Think about that. We weren't just fighting the cancer. We were literally disarming the patient. So eventually, the medical world started to catch on. They realized, hey, wait a minute, the immune system is a really powerful ally. And so began the age of immunotherapy. But their first big swing at trying to harness that power, well, it was well-intentioned, but it kind of went down the wrong road. Everyone got really focused on this one signaling molecule. It's a type of cytokine called interleukin-2. You'll hear it called IL-2. It got approved way back in the 90s, and it was hailed as the key to growing more T cells. And for a really long time, IL-2 was the only game in town if you wanted to do this kind of therapy. But here's the thing. IL-2 had a secret, a dark side. Yeah, it did help some of those good cancer-killing T cells grow, but at the same time, it also caused a massive expansion of a different type of cell. It's called a regulatory T cell, or a Treg for short. And a Treg's job is to pump the brakes on the immune system to keep it from going haywire.
So what was IL-2 actually doing? It was hitting the gas and the brake at the exact same time. And a lot of the time, that just ended up protecting the tumor from being attacked.
So you have to ask, what if there was another key, a different molecule that could just hit the gas without touching the brakes? Well, guess what? There is one. And yep, you guessed it, it was also hiding in plain sight.
Let me introduce you to interleukin-15, or IL-15. This molecule does everything we hoped IL-2 would do, but it does it way, way better. It specifically grows our most elite cancer-killing soldiers, the CD8 plus T cells and those natural killer cells. It helps our bodies build a long-term immune memory so it can watch out for the cancer coming back. And here's the most important part. It does all of this without growing those Tregs that suppress the immune system. It is all gas and no brake.
And get this is the real kicker. This is not some new revolutionary idea. Way back in 2007, the National Cancer Institute, yep, the same people who championed that nude mouse model, they held this big workshop. They looked at 120 different immunotherapy drugs to figure out which one was the most promising. And their number one, top of the list pick, you got it, interleukin-15. So what happens when you finally find that missing link? What happens when you use the right key, IL-15, to solve this decades-old problem of lymphopenia and actually rebuild the patient's own immune army? Well, the early results are, honestly, they're staggering. Just take a look at this. This is data from clinical trials with a therapy based on IL-15 called Anktiva. In patients with a really tough-to-treat bladder cancer, they saw a 62% complete response rate. That means for 62% of them, the cancer was just gone. Then look at advanced lung cancer. It more than doubled how long patients survived compared to the standard treatment. We're talking jumping from an average of 9 months all the way up to 21 months. This is a huge fundamental shift in how we think about cancer. The goal is no longer just about poisoning the tumor. It's about fixing the damage the old treatments caused. It's about rebuilding the patient's own immune system from the ground up and empowering their body to win its own war. You know, the story of lymphopenia and IL-15 is just this incredible reminder that sometimes the biggest breakthroughs don't come from some brand new thing, but from going back and correcting our oldest mistakes. And it really makes you wonder, doesn't it? What else have we been missing? What other scientific truths are just sitting out there, hiding in plain sight, waiting for us to finally see them?